Hello, everybody, and welcome to Ask Doc Live. Hope you're having a fabulous day. And as we're letting everybody in, I just want to remind you that if you have a question for Dr. Wallach and you are on live with us, make sure you raise your hand. Go to that Zoom menu, find the raise hand option, put your hand up, as I will be calling on people in the order that their hands are raised. Now, if you're watching the replay, you can go to askdoclive.com and use the contact us. But most importantly, if you heard about this program from somebody specific, make sure you get back with them with your questions first, because they probably have the answer if they share this program with you, or they have connections with somebody that can help you get the answer. So we want to make sure that everyone gets empowering information that helps them in choosing, folks, choosing. We choose which direction our health is going to go, because the man that we have here is one of the co-founders of the science that has proven that disease and genetics, it's not 100%. People do not have what they are calling as genetic diseases because of genetics, folks. Epigenetics. That's what the genetics is, epigenetics. But anyways, back to where I was going. I want to make sure that everybody has the opportunity to ask their questions. So again, find that raise hand option in the Zoom menu. You may look for where it says reactions. If you click on that little icon, you'll find the raise hand option there. My name is Rebecca Dukes-Kozak, and I welcome you to Ask Doc Live. Now, this program is being brought to you by AskDocLive.com, and we want to be a resource to others. We want to empower people to take control of their own health. Folks, sick management is not working. Well, yeah, it is. It's keeping people sick. But we're all about making sure people have the information that they need in order to have a healthier life journey. Now, the content of this information is to provide educational information only on the importance of, Doc doesn't like supplementation, but essential nutrient intake, folks. Our bodies were designed with specific nutrients. We need to keep that going. It just makes sense. And part of what this program does is to provide you information on products and resources that we have found that actually work. And the nice thing about it is one of the formulators of some of our main flagship products is the man that we have as our guest on this program, and they do work. I'm testament of that. Back to epigenetics, folks. Epigenetics is the science that proves that what we have in our environment, what we put in our body, affects the way that our genes are expressed. So if you're surrounding yourself with toxic stuff, whether it's on your skin, whether it's in your air, whether it's in your food, it's going to affect the way that your genes work. So let's give the body what it needs to not be toxic and to be able to express those genes in a much healthier way. My co-hosts and I welcome you. If you are on live with us, turn that chat on, because there is going to be information that is shared in that chat that will help you find the information that you need in order to get the nutrients, the names, special links, all those things, including Dr. Wallach's books. So without further ado, on behalf of myself, Rebecca Dukes-Kozak, my co-host, Shanti McCollier, Ruth Ellen Sanchez, Heather Bowen, and Dr. Judy Reynolds, welcome to Ask Doc Live. And Dr. Wallach, welcome to Ask Doc Live. I know you've got some great information to share with us, as you have been deep into using nutrition and food to heal the body for 8 decades, almost 8
correct.
decades. Yeah. So share with us, because I know you have some amazing information that is empowering that everybody needs to hear. So please share with us.
Okay, well, thank you so much, Rebecca, and the team that you put together. And I'm very, very excited. Today, we're going to talk about the cardiovascular system. Each year in America, we spend, just for treating symptoms of heart issues, we spend $316.8 billion, $316.8 billion just to pay for treating the symptoms of heart issues. Now, that's about half of what we spend for arthritis. Okay, now we spend for arthritis $626.8 billion to treat the symptoms of arthritis, not to prevent it, not to cure it, but just to treat the symptoms. It's kind of a crazy system we have where we're just treating the symptoms. Well, the heart, of course, is a very important organ. We can't live without your heart. It provides blood and oxygen and nutrients to every cell in the body. And it's a very complex organ. It's a muscle, and it has connective tissue valves and tendons that attach the valves to the muscles of the heart. We have coronary arteries, which provide blood to the heart and oxygen to the heart itself. It's kind of internal circulation, if you will. And then we have the big arteries, the pulmonary artery, which goes to the lungs. We have the aorta, which goes to the body and provides all these nutrients. And so the heart is a very important thing. We also have nerves coming into the heart. Some of the more important ones are the nerves that come in from the brain. We're talking about the cranial nerves. And most people don't even think about that the heart, it responds to the cranial nerves. And a lot of times issues that doctors say are heart issues are really osteoporosis of the skull, squeezing those nerves, causing the heart to do like atrial fibrillation and tachycardia, fast heart rate, and bradycardia, slow heart rate. Those are all caused by the skull squeezing the 10th cranial nerve, the vagus nerve, which controls the rate and rhythm of the heart. Kind of crazy when you think about it. $316.8 billion every year just to treat the symptoms of heart disease. Now, the heart, being a very active organ, I mean, it's working while you're sleeping. It's still working hard while you're sleeping. Just think about that. Most every other organ goes to sleep when you go to sleep, but your heart works hard while you're sleeping. Your heart works hard 30 hours a day, right? If there is such a thing as 30 hours a day, the heart does it. And so it requires an enormous amount of nutrition to pull this off. And that's where the shortcoming comes in, okay? Let's start out with how many nutrients does a heart need? Well, the heart needs 90 essential nutrients, just like all other tissues in the body, 60 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. And some of them are critical. If you don't have some of those nutrients, when you're an embryo, you'll be born with a heart defect. You might not even be born alive. You might be born dead, sort of thing. Okay. And then also, you need these nutrients to prevent a fatal heart attack. Okay. And so it's the same thing that causes a fatal heart attack in an adult is what used to cause sudden death syndrome in babies. And of course, doctors had that one all wrong. They blame sudden death syndrome on mothers laying on their babies and suffocating them. They missed it by 1 billion miles. Okay. Now, Dr. Milan and I went to China. We spent 7 weeks there in Heilongjiang province, Qishan University, which has the highest rate of cardiomyopathy heart disease, which is sudden death syndrome. It's caused by deficiency of a single nutrient. We did 1,700 autopsies in 7 weeks and did all the chemistry and all the history and all of each case. And plus the gross autopsies and everything. And it was published in medical journals, okay, in 3 languages, in Mandarin, Cantonese, and English. So we're very, very excited about that. And of course, I received the Klaus Schwartz Award from the University of California and Dr. Gerhard Strauser, who really should have gotten a Nobel Prize for discovering that some of these nutrients were essential nutrients. But doctors said, oh, they're poisonous. Don't put them in the baby formulas. I had tried for 20 years to get them in baby formulas. And we sued and petitioned and sued and petitioned and sued and petitioned. But after 20 years and 12 lawsuits and hundreds of petitions, we finally got the FDA to require these nutrients to be put into the baby formulas, Enfamil, Similac, and so forth. And suddenly now, sudden death syndrome went away. Okay, because it was just hypertrophic cardiomyopathy heart disease. And there's those 1,700 autopsies, 100 of them were under the age of 1 year of age. In the United States, they would have been classed as sudden death syndrome. And so, again, I got that Klaus Schwartz Award for that. Very proud of that. And then some years later, in 2015, received the, get it right here, Lifetime Achievement Award on Natural Medicine, okay, from the United Nations. This was August 2015. And this is me in the main offices in New York City. The main offices of the United Nations being presented with the award. Just so proud. Now, this is not an annual award. This is, now the United Nations is over 80 years old, okay? And I'm number 3. I am the 3rd one to be awarded with this. They really do not award this every year. This is awarded very sparingly. And I'm just really honored to be awarded with this award as the number 3 person to get it, okay? And of course, it's on the back cover of It's All in Your Head. It's all part of the deal, okay? And so, this is where people want to stay away from all the bad foods, and so to prevent toxic injury to the heart muscle and valves and arteries and so forth. When you have blocked arteries in the coronary arteries, which supply blood and oxygen to the heart muscle itself, these injuries are not caused by cholesterol. These injuries are caused by fried foods, processed meats, oils like salad dressings and things like that. And they've caused oxidation of the tissues, of the lining of the arteries, and your body sets up scar tissue there to try and defend itself. And that's what this plaque comes from. It's your body responding to this irritation of eating these oxidized fats and oils and so forth. Okay, so that's where this plaque comes from in your coronary arteries, your aorta and pulmonary artery, and the peripheral arteries and so forth. And let's see here. Then you have to appreciate that all these 90 essential nutrients, and of course, that's why we came out with a Healthy Brain and Heart Pack, because we realized that even though the 90 essential nutrients in the Healthy Start Pack was correct, it was a small hammer. We needed a bigger hammer for the heart. So we came out with a Healthy Brain and Heart Pack. We could have called it the Healthy Brain and Heart and Liver and Lung and Kidney and Intestinal Pack, but that was too clumsy. So we just called it the Healthy Brain and Heart Pack. And I take 2 of those per month. I only weigh 142 pounds, so I take a full dose of everything twice a day. Because of all the connective tissue in the heart, you also need the MSM. 3 of those, 3 bottles a month, okay? Now let me back up, 2 bottles a month of the, the MSM. So you can take 3 times a day. That's so 3 of these tablets 3 times a day. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, which is in the valves of the heart, and the connective tissue in the walls of the arteries and veins and so forth. Very important. Okay. And then let's see here. We also need the collagen peptides, which is collagen doing the same thing for the valves of the heart, the tendons and connective tissue in the heart and the walls of the arteries and veins. And you're looking at the sac that the heart sits in. Okay. The pericardium is called, okay, and it's like a sac that gets filled with fluid to, lubricate the outside walls of the heart so it doesn't get dry and burn itself up by rubbing against other things. And so you need to have these collagen peptides. I take a scoop of that with breakfast, a scoop of that with dinner time, and I only weigh 142 pounds. And then you also need the Beyond OsteoFX. Beyond OsteoFX. This is just to help with the connection to the nerves and also to the skull. Well, what's the skull got to do with the heart? Well, the 10th cranial nerve, remember, there's 12 pairs of cranial nerves. 12 come off the right side, 12 come off the left side. And then, of course, the spinal cord comes out of the back. But the ones that you have to pay attention to is the number 10, okay, the vagus nerve, which controls the rate and rhythm of the heart. And when you get AFib, atrial fibrillation, doctors say, oh, this is bad stuff. We got to do an ablation. What's an ablation? Well, they want to anesthetize you, cut your chest open, take your heart out, and put branding irons on your heart, trying to go back to a standard rate of beating as opposed to all over the place. And so this is a very, very, what should I say, dangerous procedure, ablation. They have a very high death rate in this procedure, so don't go along with that one. Okay, it's very dangerous. But doctors make a lot of money doing that, and so they always push it. But it's a very dangerous procedure. Ask them, well, what percentage of people who get treated with this ablation die? It's very high. Okay, and so you got to deal with that. And then because you get these coronary arteries blocked, and the aorta blocked, and the pulmonary arteries blocked, and the veins and everything blocked, we have what we call the Ultimate Daily Classic tablets, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, as well as in the arteries and veins, and support healthy blood pressure and support healthy blood flow through blocked arteries, including the coronary arteries. And so you may be able to avoid being anesthetized and having stents put in the coronary arteries, and doing quadruple bypass and all this kind of stuff, okay, which also have dangers. Anytime you're getting anesthetized and having things stuck into your heart arteries and things, it's dangerous. And also, you want to be taking, when you take the Healthy Brain and Heart Pack, you'll notice it's got a large number of the EFAs and EFA pluses in. Every once in a while, they'll get back ordered. And so we also have what we call the Prohoba Omegas. Now, the Prohoba Omegas, okay, they have both EFAs and EFA pluses in one capsule. Okay, so I take those. I take maybe one or two twice a day, along with my 3 EFAs and EFA pluses twice a day. And so if there's a back order on the EFAs or EFA pluses, I can ramp up on my Prohoba Omegas, okay? And so I'm always, what should I say, I'm always putting things in perspective when it comes to prioritizing the heart. I mean, I can do without a knee, but I can't do without my heart. I can do without a lobe of my lung, but I can't do without my heart. I can do with only one kidney, but I can't do without my heart. Okay. And so you really want to go out of your way to avoid all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, bran, no sugar, no carbonated drinks. And even the diet one's got to go. And then you need to take in the 90 essential nutrients. And personally, I like the big hammer, we call it, the Healthy Brain and Heart Pack. You could probably get away with the Healthy Start Pack. But I mean, you're really, you can't even say the bad foods. You can't even say the words, because you don't want any toxic things going on with your heart and arteries and veins. That's one of those things, because they provide the nutrition and the oxygen and the blood flow to the brain, the lungs, the kidneys, the liver, the muscles, the intestines, the stomach. Everything in your body is dependent upon what goes on in the heart. And so you really have to make that a priority. And I probably should talk about the heart more than I do. But that's why we have 500 to 1,000 young athletes die each year from sudden heart death. It's the same thing that causes sudden death syndrome, is hypertrophic cardiomyopathy heart disease, caused by a deficiency of a single nutrient. Everybody says, which one is it? Which one is it? Well, I used to tell people which one it was. And then they would take that one nutrient and leave out the other 99, and then they would die. So that's why we came up with a healthy a start pack. And that's why we came up with the Healthy Brain and Heart Pack, to make sure everybody knew that there were these prepackaged programs for the heart and the vascular system. And just remember, osteoporosis of the skull is what causes atrial fibrillation. It's not a heart issue. Osteoporosis of the skull is what causes tachycardia, fast heart rate. Osteoporosis of the skull is what causes bradycardia, slow heart rate. Osteoporosis of the skull can really cause all kinds of stuff going on, and to contribute to pushing you towards a heart attack. So you really, 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 really have to go out of your way to make your intestines happy so you can absorb these nutrients, none of the bad foods. The only people who are not sensitive to gluten are dead people. I repeat that. The only people who are not sensitive to gluten are dead people. So if you're eating gluten, you're really putting your heart in danger, your lungs in danger, your liver in danger, your kidneys in danger, your brain is in danger. Everything's in danger if you're eating gluten. Get rid of it. If you have a 6-month supply, box it up, give it to your doctor with love, and write it off your taxes. If you're doing a longevity business, you can write that off as your taxes as a advertising thing and as a health support. Okay. But pay attention to those details and you will be blessed. You will save yourself an enormous amount of unnecessary misery. You'll save yourself an enormous amount of money and you'll add many healthy years of your life, as many as 25 to 50 healthy years of your life. Is that not worth doing things right? Of course it is. To add 25 to 50 more years that you can spend with people you love, to spend 25 to 50 more years doing the things you love to do, is that not worth doing it right? Absolutely. That's why you put oil in your car. You don't put dirt from Texas in your car and hope there's oil in it. Okay. And so you got to pay attention to those details. Don't forget right now, just for treating symptoms of heart disease, we're spending $316.8 billion a year. But yet that's only half what we spend for arthritis symptoms, $626.8 billion a year for treating arthritis symptoms. So with that, I'm going to turn it over to Rebecca and we'll follow your orchestration, dear.
All right, Dr. Wallach. One thing that I want to point out, folks, what did Dr. Wallach say was the cause of plaque and buildup in the arteries and the cause of heart disease? Did he mention anything about salt? No. Dr. Wallach, so many doctors, and I experienced one this week that said, cut salt out of your diet, cut it out of your diet. Share with us your view on salt.
Okay, well, salt is one of the earliest supplements that man and woman ever had, going back thousands and thousands and thousands of years. And people realized that people needed salt. I mean, we're talking thousands of years ago. They would take salt water and boil it and get rid of the water, and the sludge that was left had all the minerals in it, including sodium chloride salt. And that's why we have the pink Himalayan salt, because that comes from the oceans. Okay, the pink Himalayan salt is an ocean related source. And when people were good, when people did good things for the community, they were known as what? The salt of the earth. So people knew thousands of years ago salt was very good. And so people would, on the coast, they would boil salt water and then take the resulting salt to the inland towns and cities and little farm villages and so forth, and sell the salt to them, not only for themselves, but also for their horses and their livestock and so forth. And everybody knew you would get sick and die if you didn't have salt. I mean, everybody knew this. We're talking thousands of years ago. And here comes a doctor from Harvard, okay, says you can't have salt. You got to get rid of all the salt out of your body. They should have their licenses taken away and they should be put in jail for their life, okay, when they say stuff like that. To tell people to get on, it's like saying, you cannot use oxygen. Get off of oxygen. No more oxygen. Stop breathing. That's how stupid this is, okay? And so I urge everybody, get our pink Himalayan salt. Our pink Himalayan salt has 78 minerals in it, okay? And I take a minimum of a half a teaspoon twice a day, half a teaspoon with breakfast and half a teaspoon with dinner time. And I'm either having rice or sweet potatoes with breakfast. I don't have any gluten in my diet whatsoever. So I have rice and sweet potatoes and maybe a baked white potato once in a while for breakfast, and the same thing with dinner, or if sometimes at lunch. But I always put that pink Himalayan salt on it. So I'm also always giving my pancreas what it needs, giving my stomach what it needs. The chief cells in the stomach require salt to make stomach acid. Sodium chloride is turned into hydrochloric acid. You need hydrochloric acid to absorb minerals and to also to digest food. And so If you start cutting out salt, you're going to create more disease than you've ever heard of. I have to look this one up. I have to look this one up. I've never heard of this disease, and that's because you're salt deficient. Do not give up salt. If a doctor tells you got to give up salt, say, "Excuse me, doctor, but I want my files and my records because I'm going to go someplace else." Bye, and you get rid of them because he's telling you to do something that's going to kill you.
Right. Now, folks, I want to really point out the salt that Dr. Wallach mentioned. It's not the salt where it's just the sodium chloride that's been taken out of the complete package. We're talking about whole salt, Himalayan salt, sea salt that's in its natural form that is just ground up so that we can sprinkle it on our foods. It includes all the minerals as
78.
nature designed. All of them work together. So we want to make sure that we're giving our bodies all of them together, because those cofactors, those things that God, creator, put together, they were put together for a reason. They weren't designed to be taken apart and just used individually. Whole food, including your salt.
So, my gosh, I believe you got it.
Well, Dr. Wallach, I've been paying attention and learning from the best. So there you go.
Yeah. Well, very proud of you, dear, because you hit the nail right on the head. It's the combination of everything. You got to do it all. And that's why we came up with systems. We don't talk much about individual nutrients. We don't talk much about individual nutrients. But if you read the books, for instance, if you read the book Epigenetics, if you read the,
got it right
here. Read the book Rare Earth Spin Cures, and you get a hair analysis. And of course, it'll tell you what mineral nutrients are good in the amounts you have in your body, which are low, which are high. It'll tell you, if you have that book, the hair analysis will tell you whether or not you have toxic metals like lead and mercury and uranium and other toxic metals like aluminum, that kind of stuff. You cannot tell from a blood test. Now, how many of you have had your medical doctors order a hair analysis? Okay, well, you do it yourself. It'll be very economical. You write it off your taxes as part of your health program for your longevity business, which is a tax deductible item. Rare Earth Spin Cures is specifically written so people knew how to get the information on a hair analysis, how they knew to get the information on what each mineral does. So if you want to find out what calcium does, for instance, it's very confusing. Doctors know nothing. When you take your hair analysis to them, and I like to have fun with medical doctors. Okay, you put that down. I'd rather see your face than the cover of the book. Okay, there you go.
Sorry.
Okay. Okay. And so when you look at the information in that book, you get that chart on the essential minerals, and sometimes your calcium will be off the chart. I mean, it'll be just, there's no more space on the page. It's just going up and up and up and up off the page. And doctors say, well, you're taking too much calcium. You got to stop taking calcium. You're overloaded on calcium. That's absolutely 100% false. The doctor does not understand what he's saying, he or she are saying. Okay. That's because what happens is, when you are seriously deficient in calcium, your parathyroid glands pull the calcium out of what's left in your bones. Okay, because they're confused. Okay, so they pull it out of your bones, and so to try and maintain the calcium levels in your blood, and they do it, too aggressively, and so the calcium level begins to go up in your blood, which then it goes up in your hair analysis. And they're confusing and thinking you're getting toxic levels of calcium. No, your parathyroid glands are just pulling too much calcium out of your bones. Okay, so what you want to do is take more calcium, and then 3 months later, take another hair analysis, and the hair calcium will come right down, because once you give your body what it needs, it stops pulling, the parathyroid glands stop pulling it out of your bones. Okay, and so this is all written up in this book, Rare Earth Spin Cures. I probably don't talk enough about this book because it has an automatic, which they say, people buy that book just from the title, Rare Earths Forbidden Cures. And so you're going to see things in there that you were never taught in school. The doctors were never taught in school. And so this book, Rare Earths Forbidden Cures, can add 25 to 50 healthy years to your life with the information. Okay, back to you.
All right, Dr. Wallach. Well, I want to talk a little bit about calcium because we have our OsteoFX products. We have the Ultimate and we have the Beyond OsteoFX. You mentioned both of them. One of them is in the Brain and Heart Pack, and that's the Beyond OsteoFX. And I'm going to say that's one of my favorite calcium products, Dr. Wallach. And here's why. Not only does it include calcium, but it also includes things like magnesium, phosphorus, potassium, boron, zinc, copper, strontium, MSM, which you mentioned also, glucosamine. All of these cofactors that actually help the body to be able to distribute, absorb, and hold on to the calcium where it's designed to be. I mean, how brilliant is that? I just think you're brilliant. Your team is brilliant.
Well, the team is brilliant. We'll give credit to the team. And I can't thank you enough for you and your team, because you guys are part of our team. And you do such great things for people in the world, because, this program is posted, right? So after we do this today, people can go next year and see today's program, correct?
That's right. That's right. We have programs up from 2 years ago when we first started in July of 2020. So they're all there. And I encourage everybody to go back to askdoclive.com and you will see all of our shows from the history of our almost exactly 2 years in existence of Ask Doc Live. I think it's fabulous that we can hold on to all that information, have that information, not just to keep to ourselves, but to share with others. I get emails all the time thanking me for taking the time to share information with others.
Well, you're definitely an angel of God. We're very proud of you.
Well, I'm honored to be part of this team. I thank Michael Zorling for being the brain master of putting together Ask Doc Live and Critical Health News and all the things that he does. And John T. McCollier for being the technical guru that he is to make everything happen. He takes ideas and he makes them happen. I just host and enjoy and do the fun stuff. So I'm excited to be able to do that. And folks, I just want to remind you that the FDA does require us to let you know that this information, this program, is to provide nutritional education information only. It's not meant to take the place of your primary care physician. And the products are not meant to treat, diagnose, or cure any diseases, but as empowered individuals, you do have options available. And we are so honored, Dr. Wallach, to have you, somebody that was so instrumental in the beginning findings of making this information available, and the power that we have through digital media, through radio, just making sure that we're not keeping it to ourselves, because it does no good, folks, to keep this information to ourselves. When you have somebody hurting and you've heard this program, for me, when I first started taking the products, I couldn't keep it to myself. I felt guilty when I saw somebody that was suffering with things that I had overcome if I did not share with them. So I invite you and I encourage you to be able to share this information as well. Let's go to some hands.
Okay, let's do it.
All right. The first hand that we're going to go to is Wayne. Wayne, go ahead and unmute yourself. You are on live with Dr. Wallach, my friend.
Good morning, Rebecca. Good morning, Dr. Wallach and friends.
Yes, sir. How can we help you?
Quick question. When you prescribe collagen peptides for somebody who might have osteoporosis of the skull, which of the collagen peptides are you referring to? Because there are two on the website.
Okay, I like the original collagen peptides. Okay, it comes in a big canister. Okay, we also let's see here, have collagen peptides in hair, skin, and nails. It's in there for the skin, which is a connective tissue. Where are you from, Wayne?
I'm originally from Jamaica.
Where do you live now?
New York.
Okay, and then how old are you?
I'm 59.
And how much do you weigh?
150.
150. Okay. Do you have any issues, any joint problems or back problems or skin problems?
Well, I was bit, and my medical doctor would say that, of course, my cholesterol, I do have a cholesterol issue, for which I'm taking your protocol.
Okay. Yeah, don't take any statin drugs. Okay, so statin drugs will give you Alzheimer's disease. Alzheimer's disease did not occur until statin drugs came along. Alzheimer's disease is a cholesterol deficiency. A significant portion of your brain is cholesterol, good cholesterol. When you start cutting back on cholesterol and interfering with cholesterol information, nutrition, and behavior, you wind up with Alzheimer's disease, MS, multiple sclerosis, all kinds of stuff, peripheral neuropathies. And so the statin drugs created an entire new family of diseases that nobody had ever seen before, which are really just cholesterol deficiency diseases. Now, there had been dementia for thousands of years, senile dementia. People get older, they didn't have enough blood supply to the brain, they couldn't remember their own name and all that kind of stuff. But Alzheimer's disease is a very specific type of dementia. But everybody who has dementia today has Alzheimer's disease. Why? Because insurance pays a lot to treat Alzheimer's disease. So doctors, whenever they have somebody with dementia, they're always going to call it Alzheimer's disease because they get paid more. Got it?
Yes, but before I go, back to the original question, how would I differentiate which of the collagen peptides you're talking about when you said one is to take
okay, I like the one that's in the big canister. It's called, let's see here, collagen peptides. Okay,
is that the one with the orange color or the blue one?
No, it's a white one.
Blue and white label.
The blue and white. Okay, thank you.
Yep, that's my favorite. I take a scoop of that my morning drink. I take a scoop of that my evening drink. And we came out with that because I was complaining that we didn't have enough sources of collagen peptides. So Steve Wallach came out with that to make me happy. And of course, it took over the world. People needed that. And so it really was a good choice.
Okay, thank you very much.
Okay, Wayne. Thank you for the question.
Thank you, Wayne. Let's go ahead and move right into the next hand that is up, Dr. Wallach. And
okay.
It's Mike. Mike, welcome back. You're on live with Dr. Wallach.
Okay, we have 3 questions.
Okay. Where are you from, Mike?
Be North Texas, south of the Red River.
Okay, and how old are you? What do you weigh?
I am 80 and 3 months, so 171, theoretically 6 feet.
6 feet, 131. Is that correct?
71.
Oh, it's 171. Okay. All right, 6 feet. Okay. How can we help you? What's your questions?
Well, the first one is your comments on toe fungus.
Okay, well, toe fungus has to do with the accumulation of sweat and all that kind of stuff in between the toes, and maybe not washing your socks frequently enough, or running around barefoot and stepping in the wrong stuff and so on. And also you could have a little bit of a low immune system. Well, first of all, I like our colloidal silver because it has no alcohol in it, doesn't burn or sting. It'll kill everything from viruses, bacteria, fungus, and yeast. So you can use a dropper full of our colloidal silver in between each toe when you wake up in the morning and put on clean socks. And when you know, after your shower or bath at night, and put the romper full of the colloidal silver in between each toe and then put on clean socks, and the toe fungus will go away. Okay, but you got to be taking your 90 essential nutrients to support your immune system, so your own white blood cells and antibodies will be attacking the toe fungus from the inside. Okay, second question.
Okay, in regards to chickens, I rent a large tract of property, and I was thinking about I would like to run chickens in the chicken tractors, and of course that puts them out free range. But the question is, when I want to collect them, I'm going to offer a grain. Which would be the best grain to offer to get them back in?
Okay, I would offer them corn. There's no gluten in corn, and chickens like corn.
Okay, and last one would be, there's a product that we found in the store that says original uncured bacon has no preservatives, no processing, and blah, blah. I thought I've heard you say some comment about that on one of your CDs or videos that I have.
Okay. There may be strips of bacon that have no chemicals added to it. It's just dried or baked or something like that, maybe baked, but still it has too much fat in it, lard in it. And so, and you're going to heat that up and cook it to eat it. And so the answer is no, no, no. You don't want anything with that much fat in it, because there's just a few strips of meat in it, and most of it by weight is fat, AKA lard, AKA fat. Okay, so you got to stay away from bacon, whether it's raw bacon, cooked bacon, preserved bacon, no bacon.
Okay, well, I heard the no. The question is, if it was put in an oven and allowed to drip, would that be all right?
What do you not understand about no?
I agree. It's a no. Thank you.
Okay. Yes, it's a no, 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 no. No ham, no bacon, no ham, no bacon. If you're into eating pork, pork ribs should be okay. Pork shoulder, and that sort of stuff. Pork belly, you got to watch it. That's where the bacon oftentimes comes from. And so I if you're gonna eat pork, I would go with the pork chops and pork shoulder, that kind of stuff, and just bake them, roast them. But if the fat turns really, really seriously brown, or it's gotten burned a little bit, don't eat it. Give it to your doctor.
All right. Thank you so much, Dr. Wallach. And the reason why we don't want to heat those fats to high temperatures is because
it turns into trans fats, heterocyclamines, and acrylamides, all of which produce cancer when you eat them.
All right. And that's something we don't want to introduce to our bodies, folks. We're bombarded with enough toxins in our environment that we don't need to intentionally put something else in there that we have more control over. So thank you so much, Mike, for those questions. Let's go to Kevin. Kevin, go ahead and unmute yourself. You're on live with Dr. Wallach.
Oh, good morning, Rebecca,
Yes,
and Dr. Wallach.
How can we help you, Kevin? And tell us where you're from, how much you weigh, and how old are you?
Okay, well, raised two different places, New York and North Carolina, and I've been on your product for some time, but recently in the past year, I've been having intermittent back orders and not being able to get what my full complement of products. But now I think I'm straight. I've caught up and I'm back on it. But as you see, I still have the gray. It's darkening, but it's not getting really dark on the chin and on the head.
Yeah. Okay. So when you have white grain silver hair, this is a deficiency of one particular nutrient. Okay. And we put that nutrient in several of our products. And so when you take the other products, you're going to get some of that nutrient. When you take the Healthy Brain and Heart Pack, you're going to get some of that nutrient. Okay. And so you need to really, I only weigh 142, and I take 2 Health Brand heart packs a month. I add, extra stuff. Okay. And so again, I'm going to refer you to Rare Earths Forbidden Cures, that book, because I don't want to be saying on the air what nutrient that is, the deficiency that causes white, gray, and silver hair. Also, we have the hair, skin, and nails. You can take that. It has collagen peptides in there, but it also has the minerals in there, and the hair color will come back. Hair color, loss of hair color has nothing to do with aging. It's not an aging thing. It's due to a nutritional deficiency. And it's like the red warning light in the dashboard of your car.
Okay.
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 Okay. It's a great question, Mike. Or is this Kevin?
Kevin.
Kevin. Yeah, Kevin. I'm sorry, Kevin.
Did you have another question, Kevin?
I was having I seemingly had a stomach upset challenge, but I had a colonoscopy recently, and that seemed, I don't know if it was a heightened anticipation or anxiety because of the lengthened time that it took me to get the colonoscopy. But now it seems to have gone away. So I don't know.
Okay.
If that's a
would you ever eat out in restaurants?
Rarely now these days.
Yeah, because you can run into gluten accidentally. You go eat in a restaurant, even if you're ordering something that's not going to have any grain in it, but they're using the same grill for your food as somebody else's food. Also, do you have a washer and dryer in your own home, or do you use a laundromat?
I do not. I use a community dryer in the building I live in, an apartment building. Okay,
well, that's your problem. Okay, that's a problem, because I guarantee you somebody in the apartment building is using gluten, right? And so, probably. Yeah, and the washer and dryer, you're getting cross-contaminated there.
So what can I do about it? If I pay someone to do it, I still stand the risk of getting
cross-contamination. That's correct.
Yes.
And so you can get one of these little washer and dryer things they put in a house trailer. You get one of those and put those in your kitchen or one of your bathrooms or something like that. Mm-hmm. Okay. Or maybe even in your garage, if you have a garage kind of thing.
No, don't have it.
Okay. Well, yeah, get one of these little washer and dryer units that they put into a trailer, a house trailer.
Yes.
Okay, that's what I would get. Do it yourself and write that off. If you're doing the longevity business as a business, you can write that off as, part of your healthcare stuff for yourself and your other people in your family. Okay.
All right.
All right.
Let's have a picture of you in 3 months' time.
Okay.
You're gonna have a great story.
Hope it'll be much darker. The hair.
Yeah, because see, when the hair color comes back, that tells you that all that sort of stuff you can't see is healing too, that need that nutrient. So that's why I want you to get that book, Rare Earths Forbidden Cures, and just kind of read through it and you say, I hit it because it's saying, when you're deficient in this nutrient, one of the first outward symptoms is going to be a loss of hair color.
Okay. Thanks, Doc.
Okay. God bless you. Thank you so much, Kevin.
God bless you.
All right. Thank you, Kevin. Now, Dr. Wallach, let's talk about colonoscopies, because Monica has a question here in regards to colonoscopies also. And she says, if a cyst is found, she's not talking about polyps, but an actual cyst, should they cut that part of the intestine out?
Well, I would get another opinion from another person. You don't have to do the colonoscopy again. You can just take the results from the first one and show it to a colon therapist, okay? And see what they say. But in the meantime, you want to watch it, because you, again, just like Kevin, you can be being cross-contaminated in the washer and dryer. You can be cross-contaminated where you eat, where you work. Don't be working in a bakery or being a cook, in a restaurant, something like that, because you're going to get cross-contaminated. No matter how hard you try, you're going to get cross-contaminated. And so you have to be really, really, really aware of what you're doing, where you're doing it, and how you're doing it, to avoid all these bad issues. Okay. And it's one of those things where if you don't pay attention to those details, it's like saying, well, I'm not going to spend all that money for oil for my car. I'm just going to get dirt from Texas or dirt from Saudi Arabia. There's bound to be some oil in those sources of dirt. Well, only an idiot would do that. But there are people who think that way, okay? You have to put real oil in your car. Same way with the heavy duty grease for the lubrication, the inner workings of your engine, and of course, so forth, and also for the lubrication of your bearings in your tires and so forth. This is all stuff that you have to pay attention to, because it's very easy to get lax and say, well, I've got this new thing they've got out now, and it's got dirt from Texas in it, and it's a lot cheaper because they didn't have to process it and get the oil extracted and the heavy grease extracted. So I'm using this new thing out now, and everybody's loving it. Well, let's see how many of them are still alive in a year.
That's one way to do it, Doc. Well, Dr. Wallach, I have somebody that is writing in, and Edith is writing in on behalf of her friend, Marcella. Marcella is 128 pounds, 5'4", 74 years old. It's been a month since she had a second surgery, and she just isn't seeming to get better. She won't take opioids, or only the over-the-counter. But she fell, and due to osteoporosis, broke L3 in the spine, so that's in the lumbar region. She's had very poor sleep for years, poor eating, has had HCL, which I didn't look that up, I apologize, and has experienced COVID. The first back surgery was about 4 months ago, where they had rods and screws put in. The second surgery removed this and then put cement in. And now she has cognitive issues, no smell, no taste, and has cycles of diarrhea.
Okay,
So,
well, what do you think's going on?
well, she's got a major gluten issue. She's not absorbing.
Mm-hmm.
And then she mentions that before having COVID, she had pneumonia, collapsed lung, COPD or asthma, low thyroid, adrenal are affected, depression, anxiety, poor mood. So it's not just a little bit of a gluten intolerance, Doc. She's got a major gluten intolerance.
Well, she got gluten intolerance, but she's deficient in about 25 different nutrients.
At minimum.
Minimum, yeah.
And she has erratic low blood pressure and high heart rate.
Mm-hmm. Yeah, so she got tachycardia, okay. That's the 10th cranial nerve being squeezed by osteoporosis of the skull. And then she's got all these other things going on, okay, which tells you that she's got, some dementia, all this kind of stuff, osteoporosis of the skull, she got Alzheimer's disease, all this kind of stuff. And it's a mix. She got all these nutritional deficiencies, but she's also got osteoporosis of the skull, which is causing a lot of stuff going on with her heart. What she's describing are not heart issues; they're osteoporosis of the skull, affecting the rate and rhythm of the heart.
So what would be the full protocol that you would recommend for Marcella, Dr. Wallach?
Okay, well, Marcella needs to get off all the bad foods: no fried foods, no processed meats, no oils, no gluten, no wheat, bran, oats, no sugar, no carbonated drinks. Even the diet one's got to go. You've never heard that before, right? and then let's see here. She's 170.
128 pounds.
Okay, 120. Okay, 128 pounds. I thought it was 178 pounds. 128 pounds. Okay. She needs to, because she got all this stuff going on, I've used a heavy hammer. I'd have her take 2 Healthy Brain and Heart packs per month, a full dose of everything twice a day. I'd have her take a scoop of the collagen peptides with her breakfast drink and a scoop of the collagen peptides with her evening drink. I'd also have her take the Beyond OsteoFX, a scoop of that with her breakfast drink, scoop with her evening drink. I'd also have her take the, let's see here, the Ultimate Daily Classic tablets, take 3 of those twice a day, as 2 bottles a month, to support healthy blood flow through blocked arteries and help support healthy blood pressure. And then for the cognition stuff, I want her to get the memory effects. I want her to get our synaptive, take 2 full doses of both of those a day, synaptive and memory effects. She also needs 3 eggs twice a day with soft yolks. Hard-boiled eggs won't count. Fried eggs won't count. So she needs them soft-boiled, soft yolks, soft poached, soft yolks, soft scrambled butter. That's how I had my eggs this morning. I had 3 soft-boiled eggs in butter. Okay, soft scrambled, I guess you call them, in butter. And I've been doing this for 75 years. And it's one of those things where this is not difficult, but you got to make it a priority of what you eat, what you don't eat, what you do take as these cofactors, these essential cofactors. These are not supplements. You don't have a choice. A supplement is something, well, I can take it or not take it. But an essential cofactor, you're going to wind up, okay, like Marcella here. Marcella, she's got no less than 25 different diseases going on here. She's in big trouble. And one of these mornings, she's not going to wake up. She'll wake up dead, okay? And because you can't have all this bad stuff going on and live for a long time. There's bound to be something go on. She'll get a blood clot, which she didn't say she had any yet, but it's coming. And she can get a blood clot in a carotid artery and stop the blood supply to her brain. She can get a blood clot in one of her coronary arteries and stop the blood supply to her heart and die, okay? And so she's in big trouble. But we can reverse all that, but she's got to jump on this like ASAP.
Now, Dr. Wallach, I just want to remind everybody that, we all have a time to be born. We all have a time to die, but you don't have to reach that time where you depart from this earth in pain and misery. When you give your body what it needs, your body was designed to utilize that to create optimal health. So you're not just barely surviving, you're able to thrive until that day that you're called out of this world or to the next dimension or whatever it is that you believe. You do not have to arrive at your expiration date. How's that one, Dr. Wallach?
Yeah, there you go. Well, see, asthma, you say she's got asthma too, right? This is a very simple nutritional deficiency disease, regardless of your age, whether you're 6 months old or 2 years old or 5 years old or 74 years old, okay, like Edith here, or or Marcella, excuse me, like Marcella, Marcella. And also the asthma, okay, is a very simple nutritional deficiency disease, but you can die from asthma, okay, have an asthma attack when you're driving or something like that, all right? Also, you can have reactive hypoglycemia, eat a big meal and then fall asleep an hour later while she's driving to go visit her mother and crosses the center line, does a head-on collision and dies in a car wreck. They do a blood test on her and she wasn't on alcohol, she wasn't on drugs, and they don't know why she crossed the center line. Well, that's because she had reactive hypoglycemia, which is a simple nutritional deficiency disease. So she got to jump on this quick because she's in really dire straits here.
And Dr. Wallach, one product that you didn't mention that I really like to include when somebody has lung issues is the Oxybody. Oh
yeah, that gives you oxygen, as the name implies, Oxybody. It's a great liquid drink, and somebody her weight, even 128 pounds, she could take an ounce at breakfast, an ounce at dinner time, get that oxygen level up. And that gives you energy. It makes your heart happy, makes your lungs happy, makes your whole body happy, makes your brain happy. Oxygen is good for every cell in the body.
And it tastes good.
Mm-hmm.
I had somebody a couple weeks ago say, "Hey, I got this Oxybody. Can I overdose on it?" And I'm like, "Well, how much are you taking?" I said, "Based on your body weight, you only need about max 3 ounces for the optimal." He's like, 3 ounces. This is 32 ounces. That means
that's 10 days.
I took too much. He said, but he felt great. He was able to breathe clearly and just loved it. So, Dr. Wallach, it's amazing what the body can do when you put in it what it's needing most.
And the raw materials are cheap compared to death. Death literally costs you everything.
Well, death costs you everything, and poor health and sick management costs a ton. And just because you have insurance, that doesn't mean that it's healthier for you.
You know, insurance doesn't pay for what you need. Insurance just paid for the doctor's treatments, and that's why doctors love the insurance companies. And health insurance was the worst possible thing for human health because it allowed doctors just to prescribe drugs for the symptoms, and the insurance would pay for it. So the patient didn't care because insurance paid for it. But now that all these big companies are either leaving the country or they're going bankrupt or they're shut down because of supply chain issues, and these people, they can't get their medication anymore, okay, because of supply chain issues. And so what do? Well, they need to come to us because we can fix them so they'll never have to go back to those prescription drugs.
Absolutely. Well, Dr. Wallach, we're at the top of the hour, and I want to remind everybody that you are watching Ask Doc Live. This is a program that's being brought to you as a resource to help empower you as an individual to take control of your health and use these raw ingredients so that your body can operate and function as it was designed to do. If you were referred to this program or somebody cared enough to say, hey, check this video out, or log on to this program, ask this doctor your questions, get back with them. Thank them for sharing this information with you. Thank them for taking the time to think of you, because you are worth it, folks. You do not have to live in pain and discomfort and misery and have those labels of all these different so-called genetic diseases just because your grandmother and grandfather had them also. Epigenetics has proven that what you do today will affect tomorrow, good or bad. We are going to go on a break. Stand by, get up, get yourself something to drink, and if you know what plant-derived minerals are and you have some in your refrigerator, put them in your drink, because giving your body those essential nutrients, those essential factors, those trace minerals that are not found in our food anymore are so important. My name is Becca Dukes-Kozak. We will be right back in just a few minutes. And we are back with Ask Doc Live. I hope you are all having a fabulous time taking lots of notes and checking out that chat for those of you who are on here live and getting the information that is being shared by our amazing co-hosts, because we want to make sure that you have the information that you need in order to create your best self. Now, there are some conditions that have happened in our past that have caused some issues that may not be able to be completely corrected, but we can still give our bodies the best chance to continue on at the best that they can be. And I love the fact that epigenetics exists, folks. You know, that science of being able to have more control over what is going on in our environment and how it affects the way our bodies function. I mean, it for me, it only makes sense. How about you, Dr. Wallach? Go ahead and unmute yourself.
Can you hear me now?
I can hear you now.
Okay. Okay, so on this Juneteenth, we're ready to go. We're ready to save lives. We're ready to add to quality of life, to save people money, to save people misery. And I can't thank you and your team enough. You are a beautiful team. And, you know, in a couple of weeks, we're going to have some great announcements for people. And so I'm very excited how we're going to be growing, and it's all going to be good.
Yes, it is. Most definitely. So, Dr. Wallach, I have Frankie that wrote in from Missouri. Frankie's only 20 years old, weighs 160 pounds, 5'10", was diagnosed with Hodgkin's lymphoma in 2018 and currently fighting a third relapse. He's been treated with 6 months of consistent chemotherapy, about a month of radiation, a large bone marrow transplant procedure, which he endured a week of straight chemotherapy. And he's wondering if you could tell him what he can do to help support his body now. And
Okay, with this,
able to create a better
sure.
story.
Well, with the standard medical treatment, they look at 5-year brackets. And usually with Hodgkin's lymphoma, you get 65% chance of living 5 years, okay, if you follow all the medical treatment. And so he didn't say how many years he's been treated for Hodgkin's, or did he?
Well, he was diagnosed in 2018.
Okay, so we're talking about what, 5 years?
4 years.
4 years, almost at that 5-year mark. Yeah, okay. And so, yeah, he's at a critical point here because the chemotherapy and bone marrow transplants, all that kind of stuff can only do so much. I didn't hear anything else, okay? So at 160 pounds, he needs to get rid of all the bad foods out of his life. It's everybody in his life, his parents, his brothers and sisters, his workmates, his classmates. I mean, his dogs and cats, everybody's got to be drop dead gluten-free, okay? No gluten, no wheat, no rye oats, no fried foods, no processed meats, no oils, no gluten, no sugar, no carbonated drinks. Even the diet one's got to go because the carbonation in the diet drinks neutralize stomach acid, so you cannot absorb minerals and you cannot digest food. Very important. Then at 160 pounds, again, he's right at that cusp, but I want him to have 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month, the full dose of everything twice a day. That's the big hammer. I want him to have 2 bottles a month of our MSM. So he can take 3 at breakfast, 3 at lunch, 3 at dinner time. And that's going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, discs between the vertebrae, bone mixtures, including the bone marrow, which is your immune system. Very important here for him. Okay. And then I also want him to have the, let's see here, the collagen peptides. I want him to have a scoop of that with his breakfast drink and a scoop of that with his evening drink. And that's also going to support the bone marrow, which again is his immune system. And then I want him to have the vitamin D3, take 3 of those twice a day. There's 2 bottles a month, so he can absorb the minerals and put them in all the right places. And then I also, let's see here, want him to have what we call our killer biotic. Killer biotic is I think it's like 8 or 9 different mushrooms, but the important one in there is the reishi mushroom. And he can look it up since he's probably a techie at his age. He's probably a techie. And so he can look up what happens with Hodgkin's lymphoma when you take reishi mushrooms. You know, since I'm sure there's been research projects on that, because the reishi mushrooms really supports the immune system. I mean, really supports the immune system. And so I would like to see that. I'll probably, when we hang up here, I'll look it up myself too. What reishi mushrooms has done for patients with Hodgkin's lymphoma, because it's going to support the immune system, which is his best friend here. Okay. And so with all that, let's see here. And of course, you can use our Rebound, our sports drink for energy. And if he has other issues, does he have diabetes or pre-diabetes? Does he have, he can use our Sweeties. Does he have high blood pressure? With all that stuff there, you know, all those treatments they're giving him, he could have high blood pressure. So he might need the Ultimate Daily Classic tablets to support healthy blood pressure and support healthy blood flow through blocked arteries, whether it's in the bone marrow, the lungs, the heart, the brain. Because even though you have this bone marrow cancer, you still have to take care of the heart. Okay, because you could die of a heart attack while you're paying all your attention to the bone marrow. And so you still have to pay attention to the heart and the lungs and get rid of asthma and all this kind of stuff. And so he's got, you know, his hands full in dealing with all these issues to support his body and his immune system so he can maximize his life expectancy here. Okay.
All right. Thank you so much, Dr. Wallach. Let's go to the next hand that is up. And I just want to remind everybody that if you were invited to this program by somebody specific, make sure that you get back with them and thank them for the information that you are being able to hear today. and tell them, hey, I want to get started. I want to feel the difference, because folks, not all supplementation is created equal. And with this supplementation that we're talking about today, the way it was formulated synergistically with all those essential cofactors that the body needs to be able to process the individual nutrients into the cells. Feel the difference. We invite you to do that. So get back with the person that invited you to this program. If you were not invited by anybody specific and you're here because you are a follower of one of our other programs, we invite you to go to askdoclive.com. Use the contact us. There's also a shopping cart, a store on askdoclive.com, where you're able to look up the products that Dr. Wallach is mentioning today and get them on the way to you. We also have his most popular books there on askdoclive.com, so that it's convenient for you to be able to get the information in your hand in black and white print from the man himself. So Dr. Wallach, you have put together so many publications. It's just absolutely incredible that you have found the time to do the research, not just write about it, Dr. Wallach, but you've done the research and you put it into a form that is easily understandable by laymen, by people like me that do not have that 8-year+ degree in the medical field. You write it out. It's easy to understand. And I love the fact that it's been made available to everybody around the world. Thank you.
Yeah, well, you're very welcome. And of course, that was the whole purpose of it. And I realized that when I was 9 years old, that the medical system was missing this very badly. And I had a problem. My mom and dad took me to 20 different doctors and they couldn't fix me. I fixed myself in 2.5 days, just eating animal food with vitamins and minerals added to it. And then I'm looking at vitamins and minerals for humans, and they only have maybe 3 or 5 or 10 or 20 different vitamins and minerals in them. So we came up with the Healthy Start Pack, which has 90. And then it became obvious we needed more. So we, in addition to the 90, we came up with the Healthy Brain and Heart Pack, which has 215 nutrients in it, the core of which is the 90. And so is 215 more than 25?
Just a little bit.
And so
well, that's almost 9 times more, Dr.
Yeah, see, there you go. And so I think you're worth it. Okay. Everybody needs to say, okay, I'm worth it. I need these 215 nutrients because I want to spend 25 more years with the people I love. Mm-hmm. And so we're going to do this right. We're not going to just, play with this and just not put dirt from Texas in the car. We're going to put oil in the car.
That's right. And did you guys hear that? You're worth it. You're worth the investment. We invest in so many different things and we forget about ourselves. Don't forget about yourself.
And if you're doing the longevity program as a business, okay, you have your health issues, which are tax deductible. And so you can write into your health program for your longevity business that your longevity business will pay for your health program, including your vitamins and minerals that you require. Well, guess what? They all become tax deductible at that point.
Yep.
Okay. They become tax deductible.
That's right. So I love writing all those things off. So I write my supplements off. I write my internet off. I write my phone off. I write the portion of my home that I have for my office here off.
Yeah, your mortgage and your utilities.
Your mortgage, utilities, travel. When I'm traveling, Dr. Wallach, and I have yet the phone, absolutely. When I'm including business, and even if it's as I'm traveling, I'm having phone
Gym
calls.
memberships are tax deductible. Put them in your health issue.
So many different things. As an independent business owner, you can write off. But the best thing about it, Dr. Wallach, with the way longevity is set up, we don't have to have a huge inventory on hand. We don't have to work on that first in and first out as we're ordering things and keeping them on the shelves and having to try to move it, because Longevity has created these websites that they maintain. They have all the products there. They have the shopping carts. They take care of the credit card processing. They take care of the inventory. They ship it, and they also have customer service. So all of those things that to start your own longevity business only costs $30,
Which is tax deductible.
which is tax deductible. There's a lot of value, Dr. Wallach, that is offered by Longevity. And then we can build an amazing network of people that we are working together to make our communities healthier and stronger. And I'm so excited to see several people on my team that are on this call and their guests also. So I'm just honored to be able to bring you to the world.
Well, thank you. You're a great teammate.
Well, thank you, Dr. Wallach. So let's go to the next hand that
Okay.
is up. And Susan, go ahead and unmute yourself.
Hi, Dr. Wallach. Thanks for answering our questions. First of all, I want to say thank you for the plant minerals. It's like I lost my bottle. Actually, I didn't. I ran out, and then I didn't feel so good, and I went back to it. It was like, ta-da! I felt so much better. So I want to put a plug in for plant minerals. I just love them. I have 3 questions. One of my clients is 6'2", 300 pounds, 76 years old. He's a hay truck driver. He's been doing it for 50 years and probably will never stop. He has a swollen right knee and a left foot that's very swollen. And he's looking at, some serious stuff. We can hardly now walk. And he's still driving a truck. We pray for him. What would you recommend for him? He listens to your program on George Norrie all the time while he's driving his truck, and he's taking everything I can give to him. He's taking, such as the 90 blah blah blah, the OsteoFX, but he's not gluten free. So you said something about you can't supplement a bad diet. Is that true?
That is correct. He needs to get gluten free. And he needs to, switch from wheat, bran, rye, oats to rice and sweet potatoes, And, if he can't find restaurants that serves rice and sweet potatoes, he needs to eat like an Asian, and he can cook the rice and sweet potatoes at home and take them with him. And then, get his other foods, get the salad, get the eggs, get the hamburgers and stuff without the buns, and he can do fine. Okay. But at 300 pounds, he needs 3 healthy brain and heart packs per month. If finances are an issue, I'd have him take 2 healthy brain and heart packs per month and 1 healthy start pack. Okay. And then he needs 2 bottles a month of the MSM. So I take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, bone itself, including for the knee and the foot and back and so on. And then I also want him to have the collagen peptides. I want him to have 3 doses a day. He'll need 2 of the canisters of collagen peptides, so he can take a scoop with his breakfast drink, a scoop with his noon drink, a scoop with his evening drink. And that's going to help support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone itself. And then to lose that weight at a rate of a quarter of a pound to 2 pounds a day, I want him to have 1 meal a day, one of our keto shakes. It's a meal replacer. It's not to add to a meal. It's a meal replacer. You can also have 2 or 3 of a rebound drinks during the day. Okay. Our sports drink with 100 nutrients in it, 75 minerals and 25 vitamins, amino acids. But he needs to get that keto shake. Again, it's a meal replacer. It's not to add to a meal. It's a meal replacer. And he'll lose that half a pound, 2 pounds a day. And let's see here. If he needs pain relief, we have the CM cream he can apply directly to his knee. We have our Hemp FX Soothe he can apply directly to his knee and his foot. And it could be that these are peripheral neuropathies. Okay, these are things that are going on because his skull is squeezing his spinal cord, or he has low back problem, he has sciatica. Okay, you need to ask him how many times a night he gets up to urinate. Is it none, once, 3 times, 5 times, 10 times?
Yeah, I
Because-
asked that. It's only about maybe once, maybe twice.
Okay, yeah, so he's starting to get the sciatic nerves that are controlling the bladder, urinary bladder, being squeezed. Nobody should have to get up in the middle of the night, even a truck driver, to have to urinate. Okay, so when they have that happening, and women get this problem, so we know it's not a prostate issue. And so it's one of those things where when you have low back issues, it's squeezing, or skull issues, squeezing a spinal cord, you get these sort of signals, the little red warning lights. But all of this is reversible. And so we need to hear from him like every couple of weeks. We want to know what he weighs. We want to know what's going on with his foot and his knee. And we want to know how many times he's getting up at night to urinate. Okay. Also, how much he weighs. Okay.
Thank you. I have 2 other quick questions.
Okay. Okay.
I really like my eggs in butter, and I have it on the lowest flame possible. If that butter turns brown at all, is that bad?
Yeah, it's starting to get bad when you start turning it brown. You want it melted, but not brown.
Okay, do I have to throw it out and start all over?
Well,
That's what you recommend?
you could, leave it harden and give it to your doctor as a gift.
And I have one other question is that I work with clients who are complete beginners. What is the one most important start book for a beginner to learn how to do what you're talking about? You have so many books, and I have a lot of them, and I give them away to people. But what is the best start book?
Well, gosh, so here's where you want to start. But, let's see, we have Dead Doctors Don't Lie, book and CD.
Oh, there
We
you
have
go.
the book Let's Play Doctor. Okay, we have a book and the CD.
I
And
forget
then we,
about Dead Doctors Don't Lie.
we have Rare Earths, Forbidden Cures to do a hair analysis. I like people to get a hair analysis when they first start, especially if they have multiple problems, like this trucker. Okay.
Yeah.
Okay. It would be very good for these people to do a hair analysis, and that way they can see the test, what they're deficient in, if they have any toxic metals, because so many people say, yeah, I'm a trucker, I probably am just full of toxic metals. Well, let's see. The test is tax deductible if you're doing this as a as a young Jimmy business, and you have, you have a little thing saying that your young Jimmy business is going to pay for your healthcare needs and your doctor's fees and all that kind of stuff, lab tests, and why not do a hair analysis when you first start, and then see in 3 to 6 months do another hair analysis, see if you've gotten better.
Great. Thank you so much, Dr. Wallach. I appreciate you. I love you. Thank you so much.
Well, we appreciate you too, dear. Thank you so much, Susan.
Thank you,
Okay.
Susan. All right. So, Dr. Wallach, let's go
Yes,
to the
ma'am.
next hand that is up. And
Okay.
Brian, go ahead and unmute yourself. You're on live with Dr. Wallach. Oh, you were unmuted for a moment. Let's try again. I can't hear you now. I read lips, but there you go. Don't touch anything. Go ahead. You're on live.
Okay, Dr. Wallach,
Yes, sir.
heard you a bunch on George Norrie. So
Yeah, I'm going to be on
You-
George Norrie again the 28th of this month. It's a Tuesday night from 10 to midnight Pacific time.
okay, I'm 78. August is my 79th birthday. Think I'll make it that far.
Oh, yeah.
I was 6'4", now I'm about 6'2.5". I don't weigh very much. I weigh about 143. Used to weigh about 155, 160.
Okay.
It looks like epilepsy, but I don't think it is. Occasionally I'll black out, and
Now,
sometimes
Stop there. Okay. Now, are you talking about you have lunch or dinner or breakfast, and then an hour or 2 hours later you black out?
No, it happens very rarely. And I've been given by a physician. I live in Colorado, outside of Denver, town called Longmont. They gave me, I think it's a generic Kepra. It's
Okay,
low.
okay, stop. What did the doctor diagnose you as having?
I think they're saying epilepsy.
Okay. Do you have any pre-diabetes or diabetes?
No,
Okay. Do you have any high blood pressure?
sometimes. Yeah,
Okay.
usually,
Are you on medication for that?
no. I
Okay.
take some herbal medicine, but
Okay. Do you know what your blood sugar runs?
no.
Okay. Well, see, your doctors are very ignorant. Okay, because they should be doing a blood test. They should give you all the things that you need when you feel like you're ready to black out, or when you recover from being blacked out. You want to do a blood test, because I think you have what's called reactive hypoglycemia, and usually it occurs within a half hour to 2 hours after you eat. You could be driving your car or truck down the highway and just fall asleep, or you can be watching TV with everybody and you just fall asleep. Okay, you can be riding your bicycle down the street and you fall asleep. Okay, that's caused by reactive hypoglycemia. After you eat, your body releases a lot of insulin, and it'll knock your blood sugar down too low, and that's why you go to sleep. And this causes a lot of deaths on the highway. Okay, so you got to be careful. And so that's kind of what I'm
That's already
thinking.
happened. I wrecked my car. I don't have a car now.
Ah, okay, because you fell asleep while you were driving, correct?
Yes.
Okay, you have reactive hypoglycemia, and did the doctors ever mention that possibility to you?
I believe not.
Okay,
I-
yeah, they're
I don't-
they're very ignorant of these things. They're very
Well,
ignorant
I
of
know
these things.
I'm very distrustful of Western medicine.
Okay, good. So you can go to a pharmacy without a prescription, go get some test strips for diabetes, and you can get them where you have to puncture your finger and get a drop of blood, or you can get them where you pee on them and see if you have any sugar in your urine. Okay, and you can tell, you take your sugar levels before you eat, and then take your sugar levels, say, an hour after you eat, and see what it is. And it might be 75% of when you started. It might be half. Okay, and so you feel, oh, I'm really drowsy. Okay, well, that's reactive hypoglycemia. And when it really strikes you hard and it knocks your blood sugar down, I mean, like a brick falling out of the 50th story building, okay, within 30 minutes to an hour, you're asleep and you're going to crash your car like you did. I talk to literally hundreds of people every month that go through this. And the doctors want to say, oh, you have epilepsy. Oh, you have this. Oh, you have that. No, you have reactive hypoglycemia. And they're treating you incorrectly because they don't know anything about these very simple diseases that human beings are susceptible to.
Here.
Okay. So any other issues? Any arthritis problems? Any back problems? Knee problems? Hip problems? Neck problems? Any ringing in your ears?
Ringing in ears, big time, and knee problem, and a little bit of a back problem.
Okay. Yeah, you have osteoporosis of the skull. Okay, that's causing the tinnitus, the ringing in the ears. Do you have any irregular heartbeat, any AFib or slow heart rate or fast heart rate?
I don't notice it much. Over my lifetime and these episodes blacking out don't happen very often, especially if I take these meds, which I don't like. But they seem to cloud my consciousness. I don't feel like doing anything.
Yeah,
But,
well, it's because your brain requires sugar and oxygen to function properly.
Okay.
Okay, you know what to do here now. Get on let's see here, 143 pounds. None of the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, brown, rye, oats, no sugar, no carbonated drinks. Even the diet one's got to go. And then I want you to get 2 healthy brain and heart packs a month, 2 healthy brain and heart packs a month, a full dose thing twice a day. Get 2 bottles a month of our MSM, so you can take 3 with breakfast, 3 with lunch, 3 at dinner time. They're big bottles, you'll be able to do that. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone, mixed bone itself, including the skull and the vertebrae and the back and the hips and the knees and all that kind of stuff. And the tinnitus, the ringing in the ears will go away. Do you have any white, gray, or silver hair in your hair or your beard?
Yeah, it's all white.
Okay.
Well,
yeah.
not all, but mostly.
Okay.
White.
Yeah, well, this is not an aging thing. This is actually due to nutritional deficiencies. And when you start taking this program I laid out for you, the hair color will come back. So you know you're absorbing the nutrients.
Okay, sir.
Okay.
Thank you very much.
Okay, sir. Let's hear from you. I look forward to hearing from you, Brian.
Thank you, Doc.
Okay. God bless.
God bless, sir.
Thank you.
Thank
All
you,
right.
Brian. All right, Dr. Wallach, let's go ahead and go to the next hand that is up. And then I have a couple comments, questions in the chat here. So Jill, go ahead and unmute yourself. You're on live with Dr. Wallach.
Hi, Doc.
Hi,
Good to
Jill.
see
How
you
can we help
today.
you?
I am calling about a woman who's 91 years old. She's 171 pounds. She takes a lot of our products. She has a history of circulation issues with neuropathy in her feet that they really have no explanation for. Varicose veins that recently got worse at her left ankle. She has a bladder problem for 20 years. She does have some back problems. She's definitely shrinking. She's on a blood thinner and heart medication, Maltag, for AFib. She takes thyroid medicine for, I don't know, 40 years. Her diet is not perfect. She does have some gluten and sugar. The reason for my call is there's been a huge change in her health in the last 45 days, 30 to 45 days. It like happened overnight that she started with a lot of edema in her legs and also in her face. You can see it in her eyes, and she's not able to hold her head up normal. She became a lot more hunched over. She already was hunched a bit, and a lot more dramatically. And her head, her neck is actually at like 90 degrees. Like she can't hold it up and look at you.
Okay, I got it. Okay, so here we go. She's getting rid of all the bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat, bran, rhinos, no sugar, no carbonated drinks. She's got osteoporosis of the skull, which is causing that atrial fibrillation, AFib, which is a squeezing of the 10th cranial nerve, which controls the rate and rhythm of the heart. It's not a heart issue, but it can result in edema because the heart's being inefficient. Okay, and then she got thyroid issues. Okay, and then she's got vein problems here. She's got bladder issues. She's got a back problem. This is due to peripheral neuropathies, and the bladder issues again. Either the skull is squeezing the spinal cord, and or the spinal cord is squeezing the nerves that control the bladder. So she may get up 5, 6, 8, 10 times a night to urinate, or she may just be walking down the street and pee in her pants because she can't control anything. Okay. And so what she needs to do is get rid of all the bad foods, as we said, no fried foods, no processed meats, no oils, no glutens, no wheat, no bar, rhinos, no sugar, no carbonated drinks. Even the diet one's got to go. 171 pounds. I want her to have 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. Full dose everything twice a day. She needs 2 bottles of the MSM. She can take 3 at breakfast, 3 at lunch, 3 at dinner time. She needs the collagen peptides. I have her get 1 canister a month. So she can take a scoop of that with her breakfast drink and a scoop of that with her evening drink. That's to support her immune system and her bone marrow and her bones and cartilage and ligaments and tendons, including her disc between her vertebrae. That's going to help her neuropathy there. Because she has vein issues, we don't want her to have having blood clots. That's why I want her to have the 2 healthy brain and heart packs, because I want her to take 3 of the EFAs twice a day and 3 of the EFA pluses twice a day, which come with the healthy brain and heart packs. Some people say, oh, there's so many of these things in here, I'll just take 1 a day and it'll last me a year. No, that's not how it works. You're supposed to take a proper dosage for body weight. And then the thyroid issues, she can take our, let's see here, our Ocean's Gold. She can go ahead and take 3 of those twice a day. It's 2 bottles a month of our Ocean's Gold. Her thyroid issues will go away very quickly. And the edema will go away very quickly. Don't forget those Ultimate Daily Classic tablets, 3 of those twice a day. It's 2 bottles a month. And let's go there. I think that's going to cover most of her problems, including the AFib. Okay. And So give me a call every couple of weeks on her, Jill, because I think you're going to have a great story for her.
So the Ocean's Gold is not something that she takes. I'm familiar with it though. When you said the edema will go away, are you saying the Ocean Gold will help the edema go away? Or
Well, it's going to help the thyroid issue. You said she had thyroid issues.
She does, but I like specifically the edema.
Okay, the edema is
I
going to be
knew
the
it,
ultimate. The edema is the ultimate daily classic tablets.
Okay. And then any idea like why all of a sudden she just like the big shift in her neck and head and not being able to hold it up? I mean, obviously she has
Osteoporosis of the skull. She got osteoporosis of the skull. And it reaches a point where suddenly now the opening, the foramen magnum, which is Latin for big hole, in the back of the skull where the spinal cord comes out of, it reaches a point where it could be 75% occluded. And so there's so much pressure on the spinal cord, and it can happen suddenly, like a whiplash or something like that. Okay, it'd be the equivalent of a whiplash.
And is there hope for it going the other way?
Of course, your bones are dynamic. You give the bones what they want, they'll repair themselves. You don't give the bones what they want, you just take painkillers, it just gets worse and worse and worse and worse.
Yeah.
You got to give the bones what they need to repair themselves. And that's why I gave you the system I did.
Okay. Thank you, Doc.
You bet.
Just one other thing to mention, she does take Tylenol because of the blood thinner that she takes. She can't take anything else for pain. And I know Tylenol is not good for you. And she's taken it for a long time. So I just wonder if the edema could be related to Tylenol and a kind of liver problem.
No. Okay. The Tylenol, she could, replace that with just some of our CM cream and our CM capsules. She can take the CM capsules orally and the CM cream topically wherever she has pain, like her back, her knees, her neck. Okay. But she's got some major problems here.
Yeah.
She's got to jump on this because one morning she won't wake up if she doesn't deal with this.
All right. Thanks, Doc. Appreciate it.
Okay. Let's get on it and call us every couple of weeks. Let us know what's going on. Okay.
All right. Thanks, Doc.
You bet. Thank you.
Thank you, Jill. All right, Dr. Wallach. So Hilda, will you unmute yourself? Because I know you have some great questions here. If you're able to unmute, please do so. She has, one of her clients has a question in regards to cleansing, like an internal cleanse. What is your favorite product, Dr. Wallach, or combination of products to help clean out the colon?
Okay, I like our herbal rainforest. It has 13 cleansing herbs and 78 minerals in it. You can start out with a half an ounce of breakfast, half an ounce of dinner, be 1 part a month. And some people, they like to cleanse, say, for 3 or 4 or 5 days a month. Just do that. But our herbal rainforest is probably the best cleansing program on the market because it gives you these replacement minerals as well as the cleansing herbs. And so that's in addition to all the nutrients. She still needs the 90 essential nutrients and stay away from the bad foods. Okay.
Absolutely. And folks, herbal rainforest, it does taste really good. So that half ounce in the morning, half ounce in the evening just gives that gentle effect where
it's very gentle. It's very gentle, not explosive.
Very gentle. So awesome. And then John has a question and wants to know if you can restore calcium in the bones.
Oh, absolutely. The bones are a dynamic thing. They're like the beach. You can lose the sand on the beach into the ocean. You can replace the sand on the beach. You can heal your bones. And this is why we have the Healthy Bone and Joint Pack. This is why we have the Healthy Brain and Heart Pack. This is why we have the MSM. This is why we have the collagen peptides. This is why we have Beyond OsteoFX. This is why we have vitamin D3. Your bones are dynamic. They will give up stuff if you're not giving them what they need to be happy and to maintain themselves. But if you give them what they need and keep them happy, they will rebuild themselves. They can go from 0 to 100, within say 4 to 6 weeks.
Fantastic. And he also mentions Dr. Wallach.
One other thing. One other thing. The question that's often asked, well, how long do I have to stay on the program? Well, how long do you need oxygen? How long do you need water? You need to stay on the program forever. because if you stop taking the nutrients, within 3 to 6 months, you'll be back down in the hole again.
And Dr. Wallach, I'm gonna fess up. I did that, where I backed off and I was just taking, tangy tangerine, OsteoFX every 3 or 4 days. And after about a month, I started going backwards. I got back on the program and I started feeling great again. It's something, folks, that we owe it to our bodies, we owe it to ourselves, we owe it to our families to be intentional in taking what the body needs to thrive.
Well, here's
every
the equivalent. How many times do you have to put gasoline in your car? Come on, can't you just put gasoline in your car once a year and drive it every day? Of course not.
No.
You consume that gasoline. Well, the same thing is true with these nutrients. Your bones consume them. Your muscles consume them. Your organs consume them. Your skin consumes them. And so you need them every day to keep replacing what is being consumed.
Well, and calcium is just not needed by the bones. It's needed by so many different.
It's needed by every
functions
organ in the
of
body.
Every organ. Absolutely. We were talking about books earlier, and John mentions that he is enjoying a book that we don't talk very much about, Dr. Wallach, and
Okay.
that's Immortality.
Oh, Immortality, yeah. That's one of my favorites. It was fun
Share with
writing
us
that
a
one.
little bit.
Okay, well, Immortality, as the name implies, it tells you how to live a long, healthful life. And what we did was spend 5 years either directly visiting or researching, through the web and the computers, the long-lived cultures on Earth. Okay, like people in the Himalayan mountains and people in certain areas in Africa and people in certain areas in South America and so forth, the longest-lived peoples on Earth. And we checked out what it is they consciously, proactively avoided in their life, and including their diet. And then we looked at what they proactively did by eating. What did they eat? And it's kind of interesting that all over the world, it's kind of like the same. The people who live the longest are the ones who eat the same things and who avoid the same things. And so you need to give your body all 90 essential nutrients, and you need to avoid the bad stuff. And this book, I've got it here on my desk. I'm going to get this kind of in the middle of the pile here. You're right, I don't talk about it very much, but this is what it looks like. Okay, Immortality. And this book really, I think, is the first scientific book, goes into 90 essential nutrients. It tells you what bad things there are. Okay. It tells you need 20,000 ORAC points a day. Most people talk about ORAC points, they're talking about 100. You need 20,000 ORAC points a day. And that's why we have from the Himalayan mountains, funny you should ask about that, Himalayan goji. Okay, that's one of our great products. I start out with a half ounce of that twice a day. All right, the Himalayan goji. And then for kids, of course, we have the kids toddy. And the kids like the Himalayan goji, but it's which I say, it's something to support the immune system and support energy and so forth. But the kids need the kids toddy, the cherry mints, and the EFAs. And so these are the sort of thing we just kind of keep talking about this stuff over and over and over, around and around and around. And I can't thank John T enough for bringing that up, because this book, Immortality, is the only book on the market that really gets down to the bottom details. It's the only book on the market. I'll repeat that. It's the only book on the market that talks about the details of how to add 25 to 50 healthy years of your life, so you can spend 25 to 50 more years with the people you love and spend 25 to 50 more years doing the things that you love to do. This is your book. Okay, this is your book. This is the book you want to have because it will add 25 to 50 healthy years of your life if you just follow the recipes that are in this book.
And talking about recipes, Dr. Wallach, and eating options, on that book, it says CR diet. Share with us, what is CR diet?
Okay, well, the CR diets have to do with getting rid of the gluten-free, okay, gluten-free diets, essentially, okay? And so the gluten-free diets, and you're taking all these minerals, come to the CR diet. And I'll put something together for next week. I'll do my whole monologue on the CR diet. How's that?
Perfect. That sounds
Okay.
great. Awesome. Thank you so much. And folks, when it comes to questions, which I get this a lot, well, what diet should I follow? What eating plan should I follow? Do you have an eating plan? Well, Immortality has recipes in there that goes over the way we should eat.
Well, basically the CR diet is calorie restricted. So your minimal calories, you get them, and you want the maximum nutrients, but low calories and maximum nutrients. That's the CR diet. Okay. So you got my Dr. Wallach's Cooking Without the Bad Foods. It's a gluten-free. Yeah. That was a 3-year wager I had with 3 professional chefs in Canada. They were on TV, you know, the TV chefs, they had their own restaurants. And I'm running around Canada lecturing on no gluten, no gluten, no gluten, no fried foods, none of this, none of that. That's all they're serving. And so they challenged me to a challenge. And so we did for 3 years. I came up with my recipe, they came up with theirs, and they offered their customers in their restaurants, my recipes are theirs. And the people who took my recipes, they said, oh my gosh, we'll never go back to the other stuff because we're feeling great and blah, blah, blah. And so they said, well, what are we going to do with all this data now? So I said, let's put it into a book. And if you read the back cover, outside back cover, the chief, of these chefs wrote this stuff on the back of the book. You can read 1 or 2 paragraphs. They're only tiny little 1-sentence paragraphs. Why don't you read 1 or 2 of them?
So he starts out with, and this is Chef Norman, he starts out with, I have worked in the culinary industry for well over 20 years. When I first encountered Dr. Wallach's food recommendations, I believed it was impossible to cook that way. In the food industry, oil and gluten are
ubiquitous.
I gotta practice on that word.
Ubiquitous.
Ubiquitous.
You got it.
And he said, fortunately, I was wrong, and in the last 2 years have recreated every dish I can think of without the forbidden ingredients.
There you go.
Now, I mean, we're looking at over 300 pages of recipes.
That's correct.
If you have, dietary restrictions for personal reasons, for religious reasons, you can go through this book and just not select the recipes that include those ingredients. But this book is so full of things, including some of the greatest comfort foods and options that we can do to feel that comfort in the foods that we grew up on, but without the bad stuff. So I love this book. I love some of the things that I have planned for that book, and being able to bring more information to people in regards to the information that's shared there. Now, Jim has a question, Dr. Wallach.
Okay.
He's 68 years old. He's 5'9", 200 pounds. Now, Jim is he's a diehard Dr. Wallach listener, because he has been following you since the 80s.
Wow.
And he's in excellent health compared to his peers. But recently, he thinks he has what's the start of trigger finger in one of his fingers on his left hand. He gets a popping sound in the right shoulder. And occasionally, that can be painful. So he is gluten-free and has no other health concerns. What can he add to his protocol, Dr. Wallach, to help with what he has starting to show?
Okay, well, he might have osteoporosis of the skull, because when the spinal cord is being squeezed by the skull, when you have osteoporosis of the skull, squeezing the spinal cord, you get all this downstream peripheral neuropathies. You get trigger finger, you get hammer toes, you get clicking in the joints and popping in the joints and pain in the joints and so forth. You'll shrink because your discs shrink and so forth. And so he needs to get off all the bad foods, no fried food, no processed meats, no oils, no gluten, no wheat, bread, rye, and oats, no sugar, no carbonated drinks. Many of those things he's probably already doing, but that's also for the rest of our listeners here today. And then he also needs to take the 2 healthy brain and heart packs per month, 2 full doses a day. I do that. I only weigh 142, but I take a 200-pound man's dose of the healthy brain and heart pack. He needs to take 2 bottles a month of our MSM, so I can take 3 of those at breakfast, lunch, and dinner. And they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes your bone itself, including the fingers and wrist and elbows and shoulders and neck and back and so on, skull. And then he also needs the collagen peptides, a scoop of that with his morning drink, scoop of that with his evening drink. We talked about the MSM. He needs the Beyond OsteoFX, a scoop of that with his morning drink, scoop of that with his evening drink. And let's see here. He also needs vitamin D3, 3 of those twice a day. And so sometimes it's just a matter of degree. He may be short 10% of one nutrient and short 20% of another nutrient and short 50% of a different nutrient. So you take them all and you get optimal amounts of all of them. And all these complaints he has goes away. Now, 5'10", if he's works out and he's toned up, 200 pounds is not bad for a 5'9" person. Okay. And so I haven't seen a picture of him, so I don't know if it's all in his belly or if it's all in his muscle because he goes to the gym all the time. I don't know. But at any rate, all his complaints are reversible with that program that I just laid out.
Thank you so much, Dr. Wallach. The next question is coming from Yvonne, and she's working with a gentleman who is 58 years old, 230 pounds. She didn't give a height. So Yvonne, if you can raise your hand if you have more information, that'd be great. He has no respiratory issues, but he is experiencing penile atrophy. So she's wanting to know what would be causing that and what can be applied to help address penile atrophy.
Okay. Well, at 230 pounds, we only have a couple of moments left here, so I'm going to go fast. At 230 pounds, he needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, bread, rye, and oats, no sugar, no carbonated drinks, and including the dietary ones. And he needs 2 healthy brain and heart packs per month, full dose everything twice a day. He needs 2 bottles of MSM, so he can take 3 at breakfast, 3 at lunch, 3 at dinner time. He needs a scoop of the collagen peptides at breakfast and dinner. He needs a scoop of the Beyond OsteoFX at breakfast and dinner in his drink. And then, because of his penile atrophy problems, he needs to take the ProstFX, take 3 of those twice a day. That's 2 bottles a month. He needs to take the Xera test, XERA-TEST test, get 2 bottles a month of that, so he can take 3 at breakfast, 3 at dinner time. He does need to eat 3 eggs twice a day with soft yolks. 95% of testosterone is cholesterol. Cholesterol makes up 95% of testosterone. He cannot be on statin drugs to lower cholesterol. He cannot give up eggs and other cholesterol-containing foods. He must be pumping out cholesterol. And of course, when he takes the Xera test is going to convert that cholesterol into testosterone, and all the equipment should come back to where it's supposed to be.
All right. Thank you so much, Dr. Wallach. Now, a quick question. What happens if somebody has a high B12 level? What is the cause of that, and what can we do to balance?
Okay. I would not be worried about high B12 level because it's not toxic. A high B12 level doesn't do anything bad. Okay. Maybe missing something that helps it store properly in the liver, because that's where B12 is stored, is in the liver and the bone marrow and stuff like that. And so it wouldn't hurt, to throw in the MSM, throw in the collagen peptides, the kind of stuff into the 90 or the Healthy Brain and Heart Pack. But having a high level of B12 is a good thing, because most doctors, when they see people, they're seeing low B12 levels. They never see high B12 levels. So it may be high normal. I'm sure mine is high normal because I take a lot of it. And so it's not toxic. I've never heard of any single problem with having an alarming amount of B12 levels. He may not be using it as fast because he's missing some nutrient that's required in the pathway of B12. And so he's making B12 or eating B12 and it's piling up because he's not able to use it or store it properly because there's something else missing. So that's why he needs to take all these other nutrients and it'll come right.
All right. Thank you so much for that, Dr. Wallach. And we are coming up to the top of the hour, the end of today's program. I hope everybody was able to take some information and absorb it to be able to wring out yourself as a sponge and share it with other people. Because that's what that's the purpose of this program, is to be able to share with everyone. Absolutely everyone.
Well, Ms. Rebecca, I cannot thank you enough. You are an angel of God. You are helping so many people, and I cannot thank you enough for orchestrating this thing. I know it's very difficult with so many players on the staff and so many callers and so forth. And George Norrie, he loves you. He asks about you all the time. When I'm on, he says, "Are you still working, with Miss Rebecca?" I said, "Yes, sir. I'm going to do that for 600 years. So don't worry about that. We're going to take good care of Miss Rebecca." And he said, "Okay," because he is thinking about you all the time. He's very proud of you. And I'm going to be on George the 28th of this month. Okay, from 10 to 12 Pacific time. That's PM at night. Okay. And I'm very, very excited. I'm always on with him like every 4 to 6 weeks. And so the 28th of this month is coming up. Very excited about that. And so I guess we'll be on one more time before we go on George.
Yes, we will be on one more time before we go on George. And on behalf of myself, Dr. Wallach, and our crew here on Ask Doc Live, we just are honored to be able to bring this program to you. I want to thank my co-hosts, John T. McCollier, Ruth Ellen Sanchez, Heather Bowen, and Dr. Judy Reynolds today for helping keep this a safe place. We want this to be family friendly. There's a lot that goes on, folks. At watching cameras, making sure people don't take cover and all that good stuff, and making sure that the information that is shared in the chat is information that is going to benefit you in being able to make the right choices specifically for you in regards to.
And we're not going to have any shootings in our studio.
No, we're not. That's right. No shootings, no lead poisoning. We are in good hands, folks. And for those of you who were not referred to this program by anybody specific, nobody shared this information with you. You've never tried any of the longevity products. We do have a call team that is available at 855-949-7234. Again, this is for people who have never spoken to anybody, were not referred to this program, and have never tried any of the products that Dr. Wallach has mentioned today. You can also go to, again, AskDocLive.com. You will find the Contact Us. You can send us an email and one of our certified holistic health coaches will get back with you with an answer to your questions, or I'll be presenting them here on Ask Doc Live. And you can watch the replay and hear the answer for yourself on one of our replays on AskDocLive.com. Everybody, have a fantastic week. Be blessed. Aim to thrive, not just survive. Bye for now. Thank you, Dr.
Bye-bye.
Wallach.
Love you, dear.
Thank you, Anandi. Love you all. Thank you, everybody,
Bye-bye.
for joining us. Mwah.
Mwah. Bye-bye.
Bye-bye.